There you go. So today we're going to be talking about basics of back pain with Dr. Yaroslav Gelfand. I'm Sandra Arevalo, Director of Community Health and Wellness at Montefiore Nyack, and excited to have you, Dr. Gelfand. I really appreciate that you are with us. And, I love that it's a beautiful day outside today because we can see the sky and everything is nice. It feels like we are outside
That's right.
with you. Thank you for being
here. Well, thank you for having me. So I will start by just discussing the general topic of back pain. You mentioned very rightfully so that it's a very common problem.
You're on mute.
Reason for doctor visits in the United States, and the disability resulting from back pain has been equated to disability from much more, I think, perceivably serious disorders like cancer and others. And so it is actually a huge issue, and it's a big topic. The main challenge, I think, with the back pain is that it is a multifactorial issue. It is very hard to pinpoint where the pain is coming from. The majority of the patients who see me, their question is often, well, why do I have pain, doc? And the answer, unfortunately, a lot of the times is, I'm not entirely sure. There are many tests that can be done for back pain. There are physical exam tests and manipulations. There are, of course, imaging modalities that everybody is very keen on: MRI, CT scan, X-rays, etc. Anybody who had back pain is very familiar with those. And then there are some other diagnostic tests that can be performed that include nerve conduction studies, and even some lab work that sometimes can be revealing for the causes of back pain. Now, there are many different reasons why the back pain may be present, and they include some pretty bad diseases. And I'm not gonna focus on those today, because somebody can have back pain because they have cancer and they have tumor in their spine. Somebody can have back pain because they were in an accident and they have a bad fracture. Somebody may have back pain because they actually have some abnormality of the blood vessels in their back that ruptured and resulted in bleeding, and that pushes on nerves. But we're not going to focus on those today because it would be very complicated. I think what we're going to focus on is what's called the degenerative back pain. So that's the back pain that majority of the people experience, that comes from, just like it sounds, degeneration of people's backs. It's a disorder that we're still studying to fully understand, but people mostly know them by colloquial terms like sciatica, slip disc hernia, maybe some kind of a joint problem they were told they have. Some people call it a muscle spasms, and so on. So those are usually, sciatica, I think, is one of the most common ones, and a slip disc is probably the second common one that I hear. And those are the ones that I want to focus on today. So the back pain, the degeneration that sometimes results in back pain is also multifactorial. And when you try to understand why certain people develop it and certain people don't, it becomes very challenging. What we do know is there is a big genetic component, and that it's not necessarily hereditary, meaning that if one of your family members have back pain, you're not necessarily going to have back pain, but you're probably more predisposed and more likely to have one. We also know that certain genetic abnormalities, just like the ones that can lead to many other diseases, and of course genetics has been a very popular topic, is also responsible for back pain. And so there is a strong genetic component. And that's honestly one of the only definitive things we know. Whether certain certain activities may predispose you to having back pain, but we're not sure what those activities are. There have been studies that examined competitive athletes and compared the competitive athlete population, for example, to a general population. And the question was, do people who perform hard activities on their spine experience more back pain and have more degeneration, which is an interesting question. And what they found was that while degeneration based on pictures, meaning MRIs, CT scans, etc., were more present and more prevalent in people who are professional athletes, they actually experienced much less back pain. Which leads me to my second point, that pictures of your spine or of your back may look not very good. And they may show many different quote unquote problems with your back, and yet the back pain may or may not be present. In fact, there were other studies that took random people from the street and just got scans on them, got CT scans and MRIs. And what they found is that anybody over the age of 60 will have some kind of a problem in their back that can be diagnosed, meaning your doctor will say, you have this problem on your picture. But very few of them had back problems. What we call is they were asymptomatic, meaning they didn't have a problem. They had a problem with the picture, but they didn't have a problem from a health perspective. So as you can see, the picture gets more and more complicated. So not only are our tests limited, they're not very accurate. Not necessarily the test that shows a problem actually will be correlated with an actual problem that the person is experiencing. So why do people have back pain, or how does it play in our overall health and structure? Well, the spine is one of the most complex structures in the body. Honestly, every structure in the body is extremely complex, and I think when we say something is simple, we just haven't studied it enough. But the spine is truly, truly complex. It's a collection of bones, which is what mostly people think about. Well, there are bones in my spine, so it must be a bone problem. But the spine is a collection of bones, very intricate architecture of musculature with numerous different connections to those bones, role of which is to stabilize the spine and perform daily function. The discs and joints, whose role is to absorb the daily loads from both muscular compression and the daily activities. And of course, all of this system is meant to protect the spinal cord and the spinal nerve roots that carry signals back and forth from our extremities to our brain. So just by this quick description, you can imagine the complexity of the organ that you're dealing with. And any of those structures can be pain generators, okay? So, and that's where our biggest, I think, challenge comes in, that all the structures that I just described can potentially result in back pain. If somebody has a herniated disc or degenerated disc, it can be painful. There are studies both in basic science looking at the discs and in clinical studies that demonstrate that people who have disc degeneration and disc herniation can have pain. And there are provocative tests that can be done, which in themselves have a problem because these provocative tests are biased. And I'm not going to get into that because it's beyond the scope of the discussion. But the discs can be painful. The joints of the spine can be painful, just like joints in many other areas of the body. And you probably heard about arthritis. And arthritis, but people think of arthritis usually as affecting people's hands, people's feet. It doesn't have to. Mm-hmm. The joints in the spine are very similar to other joints. They have very similar anatomical structures. So they can also be affected by arthritis. The bones themselves, they can hurt if they are fractured from lack of bone density. If they are damaged by those discs themselves that degenerate and actually push on the bone in the way that they're not supposed to push on the bone. The nerves, of course, can be compressed. And if the nerves are compressed, it can be very painful. And so on. And by the way, the muscles of the spine that are supposed to stabilize it can also generate pain because of the muscle spasms, because of the asymmetry in the muscle function. All of that can result in back pain. So what do you do if you got back pain? Well, first thing is see your very nice and friendly local spine doctor. And you don't have to see a spine surgeon right away. In fact, most of the time, the spine surgeon is not necessary for your problem. Most of the time, what you really need is aggressive rehabilitation and potentially maybe some pain management interventions. But it's not wrong to see a spine surgeon. You know, we are very equipped in usually at least looking at you and directing you in the right way. Um, you can see your local physical medicine and rehabilitation doctors. They are excellent providers to take a look at your overall bioanatomy, okay, and understand your biomechanics and maybe correlate it with the pains and discomforts that you're experiencing. Sometimes you can see a local pain doctor, though, you know, depending on their training, because there are two pathways in which you can get to being a pain doctor. I think they may be more or less equipped with specifically diagnosing your pain, but they can certainly help you with managing it. So I think those are providers that sometimes maybe you get to when you said, okay, well, the diagnosing stage is done. Now I need something to be done about it, whether it's more invasive, less invasive medications, and so on.
Mm-hmm.
Once you've seen your provider, they will probably try to make a diagnosis, and hopefully they have somewhat of an answer for you. And unfortunately, that answer may not be satisfactory. They can tell you, look, you have one of those back pains that are probably 80% of back pain in this country, which doesn't require surgery, which is a good news for you. But it does require something else. And that's something else, maybe something that's going to take much longer and be more time consuming in order to help with the problem. And a lot of the times it may not completely solve the problem, unfortunately, but it will certainly benefit and it will be helpful and it will reduce the pain. And I think that's one of the main goals that we're trying to achieve. There are only very few disorders require an actual surgical intervention or surgery. If you want to know if that's one of those, then you will hopefully, after seeing one of those providers, end up in the office of the spine surgeon, who will tell you, yes, this is going to be helpful with the surgical intervention, or no, this is really not a surgical problem. And then they may direct you in another direction. They will tell you that you need aggressive rehabilitation, you need physical therapy. For lack of the better term, you need exercise, very specific exercise, very targeted exercise, because the stabilizing muscles, and we all keep hearing about them, and maybe if you're on TikTok, Instagram, or any of other social media programs, right? It's very popular to show off your core strength, but believe it or not, that is actually not the visualization of it, but the intrinsic properties of your core muscles are very important, and they stabilize the spine, and they provide significant reduction in back pain if utilized properly. I'm not going to rattle off all the muscles that are involved in it, but let me just tell you there are a lot. They're variously sized, they are variously shaped, they are variously oriented, and they're all important. And if they don't act in synergy, it becomes a problem. Imagine a push and pull system in the door. And if somebody is pushing and pulling at the same time, the door stays where it's supposed to. But as soon as one overpowers, right, the door goes in either direction, and you don't really want the door to actually go in either direction. And that's where the problem can come in. You may have something that is not muscular. You may have something that is more degenerative from a perspective of joints and discs. And unfortunately, that is the exercises can be helpful for that, but they don't always fix it. So there may be other interventions necessary. There may be anti-inflammatory drugs that are needed to reduce the inflammation. There may be drugs that need to numb the pain. There may be other drugs that will act on the nerves that are involved in the pain generating from the joint. The joint has also innervation from the nerves. So if you think about pain, it always has something to do with the nerve. So those nerves not can necessarily be operated on a lot of times, but sometimes they can be acted on in other ways, whether it's blockage of the nerve, destruction of the nerve, even though we don't like to destroy nerves, but sometimes if they're purely for pain purposes, it may be okay to essentially destroy it or numb it down, because it doesn't have any other functional purpose except pain. Now, why evolutionarily it's important, we can spend a long time talking about it. It lets you know something is wrong with your body. It lets you be aware of the things you're doing that may not be right. But once we already know all that from the pictures and from evaluating you and from examining you, that nerve may not be serving any function anymore. So it's okay to destroy, okay, in order to prevent the pain. By the way, it still grows back, so sometimes you need to repeat destruction several times. I'm going to pause because I gave you guys a lot of information, and I think it kind of provides you a general idea of what back pain is, why it can happen, and maybe basics of what to do about it. I know that the answer, well, go see your doctor, maybe not super helpful, but it's really what you have to do so they can try to diagnose you and direct you in the right manner. And maybe it will just be go get some exercise under proper guidance and regulation, or maybe it's going to be something more involved.
Yes, Dr. Gelf, thank you so much for that introduction. And that definitely has sparked some questions. So, and just filling in what you just said, exercise, is there any kind of pain or any kind of, I will say, diagnosis that will go against the exercise that we need to know about? I'm just afraid that, you know, for example, let's say I have back pain and I'm just gonna listen to this talk and I'm gonna start exercising and that wasn't the right choice and I'm gonna make it worse.
Most of the regular back pain, if you're able to perform activities, I would say go ahead and perform activities. Why? Because most of the time when you go see your doctor, that's the first thing they're going to tell you. But the difference is, how do you exercise? Not every exercise is good for your back, and not every exercise has the same amount of benefit, right? So if you listen to this talk and you say, okay, great, I'm going to go start doing bench press. Well, that's not very helpful. Okay, so the exercise that you need is a particular type, and so I would highly recommend seeking an advice from a physical therapist. You know, and in turn, you probably need a referral to them, and sometimes you don't. But I would say that what we call red flag symptoms is something that would direct you to avoid exercise, or at least to seek medical attention first. And that includes weakness. If you experience weakness in your legs, in your arms, then you need to seek an immediate consultation. If your pain, and we talk mainly about back pain, which to me refers to a low back pain, but sometimes when people say back pain, they also mean the neck.
Yes.
So neck pain is actually a very different topic, and you know, would probably require a separate discussion. While a lot of problems with the neck are very similar to the problems in the back, if you start noticing that you have problems with using your hands, dropping objects, any kind of weakness in your hands, any kind of problems with walking, any kind of problems with walking, meaning you feel wobbly, you feel that you're a little bit unsteady on your feet, that is the time not to exercise. This is the time to go and talk to your doctor.
Okay.
Of course, if you experience, well, I say of course, but it's not self-explanatory. If there are problems with going to the bathroom, if you experience a severe back pain, and then you realize that you cannot perform normal activities of going to the bathroom, meaning, you know, you try to urinate and you're unable to, or the other way around, you urinate without knowing that you do that, that's time to go see a doctor.
Okay.
Those are usually called what red flag symptoms, or something that is concerning. And in that case, exercise is not the answer.
Can we get back pain from just sitting too long? I know that a lot of us spend long hours at work just sitting down. Is that bad for our backs?
I think that has to do with essentially muscle atrophy and not using your back enough. So the short answer is yes, of course. If if the job requires primarily sedentary style, then it can lead to back pain because it leads to the muscle atrophy, and as such, can result in all the things that we just discussed. Now, people a lot of times talk about posture and say, oh, you know, I had a bad posture and that's why, you know, I have tremendous back pain. Well, there is no literature to support one way or the other. So while everybody keeps telling you, stand straighter, push your shoulders back, do this, do that, but in the end of the day, I am not entirely sure that it really contributes to back pain or neck pain for that matter. I think that bad posture can result from muscle asymmetry, and that can result in back pain. But I don't think that the posture itself can, or at least we don't have definitive proof that the posture itself can be a problem.
Can you, we have.
I saw somebody posted something in the
Yes.
chat.
What about excess weight?
You didn't mention having excess weight. Yeah. So that's a very good question. Hold on, how do I? Yes, here we go. So that's an excellent question. So I think weight loss again is usually counted as a big improvement for everything, right? We like to say, oh, you know, if you're overweight, do something about it. Well, so it really depends. I think weight loss is never a bad idea. First of all, let me just put it out there. Unless you're underweight, by the way. If you're moving from being overweight to moving underweight, that's a problem. And there are numerous studies that are coming out that are actually kind of challenging our, again, social media enforced opinion about weight. It's not good to be underweight. Sometimes for people who are a little bit older, and by older I mean anybody about 30, it may not even be good to be normal weight, quote unquote, as defined by the BMI. So we actually keep showing now that people that are considered slightly overweight are actually probably the healthiest people that we have around now. I'm not talking about people who are obese. If you're talking about people who are really heavy, that's a different story. But being slightly overweight actually may be the sweet spot. From a health perspective and from actually many different outcome studies now. Now, to have a lot of weight concentrated around the abdomen does pose a problem. Number one, that people who have that are generally shown to have fat infiltration in their muscles, especially in their back muscles, which again leads to muscle asymmetry and leads to muscle dysfunction. Now, on the positive side, actually, a lot of the times the people who are overweight have a better bone quality, especially if they've been overweight for a period of time. So, and while their discs may not be very happy with it, I actually, we're still struggling to definitively show studies that say that BMI in itself, or even the abdominal concentration of adipose tissue, or what colloquially known as fat around the belly, would be a significant factor. Again, if we're talking about significant weight gain, and we're talking when you get into the category of what's called morbid obesity, meaning extremely heavy, when the health risks are definitively becoming higher, yes, I think that as a common knowledge, we usually say, yeah, that's not good because, again, it gives asymmetry to your muscles. If you carry a lot of weight in the front, in your belly, that puts a lot of stress on your lower back. So just biomechanically, it may be an issue. But the studies are still out there, and there is no definitive conclusion.
And I guess the same will apply to large breasts, especially, you know, some women I know that they complain of back pain when they have large breasts.
Yes. Yeah, so interesting that you mentioned that. Yes, the answer is yes, it does. And the people have been diagnosed with that as again, having an excessive force on the lower back, and which resulted in recommendation for breast reductions. Another thing that you can think about is pregnancy, right? Pregnancy can also lead to a lot of back pain via different mechanisms, because the classic back pain that can result can have to do with SI joint, which is the joint between the sacrum and the pelvis, but can also result in the lower back pain, again, because of the loading of the muscles that is happening during this physiologic, frankly, stage.
Dr. Gelfand, what do you have to say about painkillers?
Well, it's interesting that that you mentioned that, since I just walked out of the bioethics discussion on opioid addiction. So I think pain management involves what we commonly known or talk about as pain. But there are many different types of painkillers.
You're on mute. No. I think it might have connected to your car, and that's the reason we don't hear you. Which tells me you have a very nice Bluetooth in your car, by the way. No. I can read your lips, but I cannot hear you. Maybe if you change the settings on your phone to speaker and disconnect the Bluetooth from the car. It's still on mute. I think now it's
Hello?
gonna work. Yeah, go ahead.
Yeah, you can hear me. Okay.
Yes.
All right. I can't hear you though, so that's a little strange. Give me 1 second. Okay, can you hear me now?
Yes.
Okay. I still have hard time hearing you, so I'm not sure if I have. Hello?
I can hear you well, but I'm not sure if you're hearing.
Yeah. Okay. Well, if you guys can hear me, that's good. But I
Yes.
can't hear you. So give me just 1 second.
We were
I'm
talking
not sure
about
why I'm dealing with
opioids
this issue.
and painkillers.
Okay. All right. So, sorry, can you repeat me the other question or maybe type it up so I can answer it?
I
Oh,
just
painkillers.
typed it.
Yes, okay. So, all right, so here is the thing of painkillers. Here we go. Here's the thing on the painkillers. There are different types of pain management medications. Number one is what we usually think of as over the counter, and they include Tylenol. So Tylenol is very beneficial because it usually helps with the pain that are in your joints and could be helpful for the disc pain and could be helpful for many other things. The other thing is we usually, when people say painkillers, they mean opioids. Well, opioid medications are helpful because they just work on pain, but they're not the mainstay of treatment for the back pain today because A, you can't use them for a long period of time. They lead to addiction, and overall, they're just not beneficial in the long term. There is a third type of pain medication that are called muscle relaxants. They're not pain medication as we usually think about them, but they help control the pain a lot because they help to relax the muscles and they help with the muscle spasm, which is one of the probably main causes for the back pain that we're usually talking about. And last but not least, there are pain medications that are considered neuropathic pain medications like gabapentin, Lyrica, and a couple of others. And those are usually the pain medications that are used to treat the pain from the nerve compression or for the nerves that are related to sending the pain signal from the facet joint, from those joints in the spine. And those can also be quite beneficial. And so usually the combination of Tylenol or over-the-counter non-steroidal drugs like with gabapentin and with muscle relaxants and frankly a lot of some other quote unquote medications to control pain is probably the better approach than the painkillers that we usually think of, which is oxycodone, Percocet, or other narcotic medications that people mention.
Yeah. Is there a difference between the pain caused by the muscles and the pain caused by nerves? Does it feel any different?
Excellent question.
So usually the pain caused by the nerves, specifically by the nerves that are travel down to patients' legs or arms or anything like that, will be a pain that is what's called a radiating or traveling pain. So it may originate in the back, but then it's going to be like electric shock like signal, like jolt that goes down into the leg, that goes into the arm, that may go down into the buttocks, may go down all the way into the foot. And it's not always indicates a nerve pain, but that's usually how it presents. Sometimes it can be even a feeling of heaviness or numbness that comes on and goes away or sometimes persists. And that's usually what we think about as nerve pain versus the back pain or muscle pain that is usually concentrated right around the area of the lower back. So people get up and say, oh, my back hurts, or I have a pain on the left side and the right side. And it's not necessarily mean that it's a pain from the muscles. It can be pain from the muscles, joint, disc, any other structure within the spine. But it's usually not the pain from the nerve because the nerve pain travels and usually travels where the nerve travels. Think of a nerve as a train track, right? Like, so that pain takes a train and it goes down the train track. versus the pain that's more localized to your lower back. Now, not every lower back pain is just a muscle pain, and again, there are certain manipulations that you can do to identify the pain generators. But those are usually the big differences that we think of. Pain that travels, or pain that goes into the legs, goes into the arms, usually related to the nerve. The pain that stays in the back and doesn't travel anywhere, usually related to the muscle. Now, here's the catch and the trick. Not every muscle or joint pain stays in the back. So the problems that come from sometimes the syndromes associated with a big joint that is between the pelvis and the sacrum, kind of around the hip area, can actually radiate and can travel. And a lot of times can travel into the thigh, can travel into the back of the leg. And so that's where a lot of questions and examination comes in to try to differentiate between those. And sometimes it's quite difficult to do. But if things were easy, then we wouldn't be having probably this conversation. So
for sure. Now, there are some other home remedies that are most common, I will say. People talk about using heat or cold or ice packs or those patches that you can get over the counter, massage, oils.
Yeah.
What do you think of all of that?
So, I think those are all excellent options. Now, there are two different questions that you have that we're asking here. One is, what do I think about them and should they be used? And number two, how helpful are they, right?
Yes.
So, and those I think are two different questions, because in my opinion, any relief that is not harmful, potentially harmful, or delays treatment is perfectly acceptable. I'm a big fan of acupuncture. I'm a big fan of seeking chiropractic manipulation only for the lower back, and I will put it out there because there are horrifying stories about chiropractic manipulations of the neck, and so I'm very cautious about those. But for the lower back, if you have low back pain, especially if I don't think it's a nerve pain, I think if it's a nerve pain, chiropractors are not going to help you much. But if it's a pure back pain associated with joints and everything else that we've described, I think it's perfectly reasonable. I think massages are great. I think that all the other what I think wrongfully labeled as alternative medicine, or non-traditional medicine, whatever term you want to apply to it, I think those are perfectly acceptable things. So you want to do oils, you want to do heating pads, you want to do any of those things, I'm perfectly fine with it. I think if you experience any of the things that we mentioned earlier that are so-called red flag symptoms, you experience weakness, you experience trouble using your hands or extremities, you have trouble walking because of the trouble with balance, I think it's time to move beyond the heating pad. But if it's it's an isolated back pain, and you want to give it a trial, I'm all for it. Now, unfortunately, whether the benefits are there or not is hard for me to say, because the studies on those are quite limited. So there are very few scientific papers written on heating pads. Now, we can ask why, and the answer is going to be, well, I think because they're hard to standardize and they're hard to perform very controlled studies on, and maybe because the treatments that are don't need to be controlled in a very aggressive manner, we're a little bit less interested in studying it. So we can point fingers on the system, we can point fingers at the doctors, we can point fingers on a lot of different things, but the truth is we lag the data a little bit.
Mm-hmm. And I think to end, because you must be melting in that heat outside, and I appreciate that you're doing this.
Okay.
Any precautions that we need to take, or any advice to keep a healthy spine, a healthy back?
Yes, absolutely. So I think somebody mentioned the weight around the belly, and while I told you that there is not much evidence, I think that weight loss and a healthy lifestyle is the number one thing for your healthy back. There is actually a big association, and I will mention that because I think it's very important. There have been studies and there have been documented correlations between smoking and back disorders. And so smoking, which I see in a lot of my patients, is a huge issue. So if you're a smoker, or if you're a former smoker and you quit, good for you, congratulations. It's one of the best things you can do for your body. And if you're not, haven't quit yet, consider the quitting options, okay? Because it is strongly correlated, and there is scientific evidence for that. The regular exercise that will support the core activity. Anything from walking to, people prefer yoga, Pilates. There are a lot of them out there, and I think all of them are actually great because they load up your core. Now, can I definitively tell you that none of those are going to hurt you and not going to result in a disc herniation? I cannot. but I can tell you that your chance of getting a disc herniation from doing those are far less than you developing back pain later down the line if you do not develop the core strength. Okay, so just risk versus benefit. I think it's a great idea to maintain a healthy lifestyle, core exercises, some weight loss, quit smoking, and also if there is any other health issues like specifically diabetes, actually, keep it well managed.
Okay. Well,
So-
thank you so much, Dr. Gelfand. I don't want to take any more of your time. I really appreciate that you were with us today, and I think I will reach out to you again because I am also interested in learning more about the shoulder pain and the neck pain that you were mentioning during the conversation. I think that there is a lot of people out there that also suffer from that. So thank you so much.
Happy to talk about it. Of course. Thank you for having me.
Yes, and if we want to reach you, where do we contact you? You're in Montefiore Einstein.
Yes, so the best way is just to quickly look me up. I'm gonna put in the chat here. I'm gonna put my name, and there's a very detailed web page with all the contact information, my office numbers. I'll type it right into the chat. If you Google me,
Perfect.
I think the first thing that comes up is my Montefiore Einstein page.
Excellent.
So I'm happy to talk to anybody else about any of these issues.
Thank you so much, and enjoy the rest of your day. Thank you for chatting with us here in Community Chats Montefiore Nyack. And thank you to all of our attendees. I will be sending the recording before the end of the week, and I'm going to send you the recording as well so that you can share with your patients, your family, your friends, to all of you, and you can share with people who you feel might benefit from this information. This was Sandra Arevalo from Montefiore Nyack Hospital. Thank you so much. I'll see you next week with Aging is the New Spring. So we're going to have a cosmetic dermatologist who is going to tell us how to keep looking and feeling young. So I'll see you next week. Thank you. Bye-bye.